want to welcome our first guest on the program and a friend of the Institute's, Jack Curtis, CEO of Corporate Health Partners. Good morning, Jack.
Good morning, Doug and Ron.
How you doing?
Hey, good to have you here, my friend. Give us a little backgrounder for our audience that doesn't know you on Corporate Health Partners, and then kind of your relationship as head of the leadership committee for HERO. Just give a background on HERO at the same time, if you would.
Absolutely. Well, Corporate Health Partners provides comprehensive, systematic wellness programs at the work site, and we're focused on weaving wellness into the culture and reducing health risk. And we're kind of known for our face-to-face health coaching that drives the risk reduction. So that's the background on CHP. I joined the HERO think tank almost 10 years ago now, nine for sure. And it was one of the best things I've done in my career. It's been a great opportunity to be a part of that think tank, which has grown to over 100 different employers, consultants, health plans, wellness providers, all comparing notes on what works, what doesn't, how we can move the field forward and get all the employers engaged in successful wellness programs. So that's been very helpful to me, and along the way I was invited to chair the leadership committee, which looks at where all of this is going and how we can help get there. So that's been a great vantage point to learn what's going on, where it's going, and to have some influence on helping it get there.
Yeah, we also really appreciate our relationship with HERO and our participation with them, and really value a lot of the thoughts that come out of that. The think tank meetings come out of the research, and you're going to headline and put together a really quality general session for us at Forum. Talk to our audience a little bit about that, and then we'll get into some other questions around kind of the CEO buy-in, et cetera.
Well, as I mentioned, one of the objectives of HERO and in general, and our leadership committee in particular, is to advance the field. So it's been a little bit of a mystery why it hasn't moved faster, why we haven't had more uptake with serious wellness programs. It's kind of like you were just talking about with consumerism. That's been around for almost 15 years now. And wellness has been around even longer than that. And so 95% of employers maybe have something, but only 7%, according to some reports, have serious comprehensive that are getting results. So you wonder why is that? And so, we've been wrestling with that, and part of what we want to talk about at the forum in June is CEOs. I mean, the key is leadership. Just like it is for consumerism, it's for wellness and health management. The key is leadership. So HERO recently did a survey with about 500 different leaders from around the country, and it was interesting to see what they thought about the connection about health and wellness and business performance. And so we'd like to talk about that some at the forum, and again, see how we can move the industry forward and get more CEOs thinking about that.
Yeah, I thought some of the highlights in that survey, Jack, I thought were very, very interesting. And this was a business leader survey. This wasn't necessarily talking to the day-to-day corporate wellness directors, although some of them did participate. But I mean, when you look at, to your point, 97% of executive leaders say that health influences performance. And 77% coming from survey of business leaders felt their organization leaders are committed to improving the health of their workforce. Those are pretty high numbers.
Absolutely. So you think, well, with that knowledge that health does influence performance, and 77% are committed to improving it, why aren't we making more of a difference? And why do we have reports like the RAND report that says, the way some people interpret it, wellness doesn't work? There's a big disconnect there. And there was a disconnect to me in that survey, and I think maybe you were even sitting with me, Doug, when they were presenting this at the HERO Forum last fall. And they asked these business leaders from these 500 different organizations to list what are the key drivers of business performance. And my takeaway from that was, it was listed, but it was way on down the list. It was not one of the top 3 or 5 drivers for most people. Only 20% of the business leaders listed health and wellness as a top driver of business performance. So it was interesting that, of course, the people, Hero folks were conducting the survey. So they said, well, it's interesting you didn't list health and wellness as a top driver. Would it not impact your workforce if half your workforce were sick or disabled? Well, yeah, it would. It would hurt performance. Well, would it not help performance if they were less sick or disabled? Because a lot of them are already. So, well, I guess that's right. So, our job at IHC and at Hero is to connect those dots so that more CEOs get it and they are more serious about their programming. So the employers are more successful and our nation is better. We can't keep affording healthcare at this rate.
Yeah, and I think and you and I have talked about this many times in the past. It's using a survey like this to really communicate, the value proposition, to a company's business model, performance, productivity, et cetera, but also to learn how to, all of us in this space, learn how to communicate to that CEO and CFO about what's important to them. Of course, their workforce is important and improving productivity and performance, but also managing risk. I mean, that's a sincere message that a CFO understands. Andy Crichton, a member of Hero 2, says that all the time. He says, hey, I got 300,000 employees. I don't go in there and talk performance first. I talk risk management and performance. Because the CEO's light bulb goes off and said, I get that part.
Absolutely.
Jack, this is Ron.
Yeah,
This is my take on it, because I think you said you're involved with Hero on what's coming next, and I think you are right on the leading edge. IHC, we've talked about these different generational aspects of the development of healthcare consumerism. The first one being just plan design, the second one being behavioral change, but the third one is how it affects corporate bottom line and productivity. I think too often the HR benefit managers' messaging to top management has been around the rewards and incentives to change behaviors and hasn't really focused on the aspect of human capital. And so I think your report coming out really is right on target and well-timed, because I think if the HR benefit manager, that HR VP guy, starts to speak in terms of, well, what is our human capital and how valuable is it? Well, sure, it's the education of the staff and the relationships, the connections, the creativity, all the things somebody brings to the work, but it also is their health. And without health, all those other things doesn't do any good to have this great, productive, smart employee if they're sick and at home. That doesn't help the human capital of that company. So I think if your report begins to get the HR VPs talking in that kind of a language, the message goes upstream. But I also like the idea that you're going directly to the CEO and trying to get them to understand. But that dual approach to get that messaging out, I think, is well-timed.
Well, thank you. I agree, and I'm excited about trying to get the word out at the forum coming up in June, because not only can we talk more about the survey, because we'll have Jessica Grossmeyer there from Hero, we'll have Nikki Hudsmith from Performance PH, who were central to this survey, but we'll have Dr. Ray Fabius there, who was one of the first people I met when I joined Hero, and he was head of CHC Meridian, and when that sold to Walgreens, he was there for a bit, but he's gone on to he actually invested some of the money he made when CHC Meridian sold into companies that had invested in a culture of health and safety. I mean, they were scored on a national survey and were known that they had scored highly, and they were also public companies so that you could invest in them and you could track performance. And those companies that he invested in have significantly outperformed the stock market. So there's an association already between good performance and good investment in health and safety. we need to work next on cause and effect to show that, well, maybe somebody wasn't there, kind of like Good to Great. You remember the book Good to Great? So where's somebody that was good, and then the light bulbs went off, the CEO connected the dots, and he made that investment in health and safety, and business performance improved. So we need to work on that next, and so there's a lot of work to be done on connecting the dots and building these case studies, but I'm excited that it's coming together now.
What is the big issue that a lot of CEOs have when you can draw sort of the logic connection, but data is another issue. What's the status, you think, of being able to really connect the dots and say, okay, if I do this, I'm going to improve my productivity by 5%, or I'm going to, improve my bottom line because there's more of a direct relationship that we can measure, whether it's just in healthcare, whether it's fewer disabilities, fewer workers' comp claims, fewer unscheduled sicknesses. What's the status of maybe some of even the HERO research or some of your members in the area putting real data together?
That's a great point, Ron. And some of the HERO members, of course, they're the believers, and they're often the bigger companies that have some money to invest in that, and many of them have won the C. Everett Koop National Health Award, which is very much data driven. So we've got some good studies that show the impact there, but that's the exception, not the rule. Again, kind of back to Rand and some of the folks in the media that talk about there's an absence of data in a lot of programs. Some are not measuring at all, and some that are measuring they haven't put together all the pieces to have a real successful program yet. So there's a lot of work to be done on getting that data. Particularly we're serving the market that's like 50 employees up to 5,000, and it's tough to get the data to show all of the benefits of health and wellness. At best, we can show risk reduction kind of from biometric screenings, but when you start to get sick days, well, some don't even track that. They're tracking PTO right. Instead of, so it's hard to get that. Or workers' comp, it's hard to get that and integrate it. Presenteeism is very difficult. It's a subjective measure, as you know. So there's a lot of work to be done there that'll to help build that business case.
Well, I think you're at the leading edge, and like you said, this is a good, timely report. I think this presentation at the IHC Forum is going to be a great platform for getting the word out to a broad audience, and all those issues that have yet to be developed with the focus and attention, the spotlights you've got on it. I think we'll see more activity in these areas so that the word can be spread and employers can start to think about wellness in these broader terms that you've put on the table.
And I think, Jack, you and I have talked about this too. I want you to kind of share the message with our audience too, because you want that corporate wellness director, that benefit director, to bring their CEOs and CFOs with them, correct, at Forum?
Absolutely. The trump card, I say it's a three-legged stool. You've got to have the metrics or the data that Ron was talking about. You've got to have good interventions that change the behavior. I mean, it's all about behavior change. But the trump card, those other two things don't do a lot of good if you don't weave it into the culture. If you don't weave health and wellness and safety into the culture, that's the CEO. So we've got to get there and not only do they fund the programs, but they lead the charge, set the example, and so forth, that make the program win or lose and determine how, if it wins, how good it wins. It's that leadership.
Yeah. That's well said, Jack. Jack, I want to give you a minute or so to leave our audience with a couple takeaways as well, and I really thank you for spending this time with us this morning.
Well, thank you very much. It's been great. One last thing, I did mention one of our panelists, and they're actually a participant in the HERO survey. There were 4 case studies coming out of the HERO survey, 4 different organizations, and we're really fortunate to have one of those case studies represented in our forum in June, and that's Intermountain Healthcare. I've known Tim Butler from Intermountain Healthcare at HERO for a long time. But Intermountain is sending Dr. Scott Hansen to represent them on the panel. So we'll have an employer there. And the great thing about them is they realize they've tied health and wellness to not only patient safety, patient satisfaction, that if they have healthier, happier, more productive employees, that their patients are going to be safer and more satisfied, and their whole operation is going to be more productive. So I'm just thrilled that we're going to basically be able to tie in all the different aspects from academia and the think tanks and a real employer and make the case. So I do hope people bring CEOs, CFOs, in addition to the HR folks to the forum to hear the message.
Yeah, I think it'll be a dynamite discussion, and appreciate all your work pulling it together. Jack, thanks again for spending this time with us this morning. Have a great weekend, and we'll talk to you real soon.
Thanks. Always a pleasure.